how to diagnose patients with gum disease. There's been a lot of questions about this on different dental forums, so I thought it would be a good idea to kind of go through all the details. So if you want to look at gum disease, you go between several stages. So usually you will have healthy gingiva or healthy gums where you don't have any bone loss. We diagnose gum disease with x-rays, and we're going to check for bone loss. And patients who are healthy, they don't have inflamed gums, and they don't have any bone loss or really subgingival or supergingival calculus. Now, the next stage would be patients who have gingivitis, and they will have inflamed gums. Sometimes it could be localized or it could be generalized. They usually have a little bit of deeper pocket depths, usually somewhere between maybe 3-4 millimeters, versus the healthy patients may have 3 or less. So these patients will have more bleeding gums, but you still don't see any bone loss on the x-ray. And then you're going to cross into gum disease area if this is not addressed here, and the patient still has poor hygiene, and or they have the genetic predisposition for gum disease. Then you're going to get into the area where you're going to start seeing bone loss on the x-ray, and then the patient is diagnosed with gum disease, and you're going to see inflamed gums. Sometimes you see super or subgingival calculus as well on the x-ray as well as clinically. And usually we break this into 3 categories, which could be mild, moderate, and severe. And sometimes they call it early, moderate, and advanced. I usually just call it mild, moderate, and severe. And in the mild cases, you just see some either localized or generalized bone loss, maybe about 1 millimeter or so. The pockets tend to be more about 5 millimeters. And then if it keeps advancing, then you're going to cross into the moderate gum disease, where you see more bone loss. Here you're going to see more like 2-3 millimeters of bone loss, and you're going to see pockets that are 6 millimeters or more. And that if that still keeps advancing, then you're going to get into advanced or severe periodontitis, where you see pretty severe bone loss, about 4 or 5+ millimeters, and you see pockets that are really, really deep, more than 6 millimeters. You also a lot of times see mobility with these teeth. And you can have generalized gum disease, or you can have localized gum disease. So it could be like just in certain spots, so that could be localized, or it could be throughout the whole mouth, which would be generalized. And the same is true with gingivitis. So this is kind of like the progression of gum disease. You go from healthy to gingivitis to mild, moderate, severe gum disease. And like I said, you diagnose gum disease from bone loss, so you need to take x-rays and diagnose this. Now, how do we treat these patients? So I did a flow chart that kind of makes it a little bit easier to follow. So your patients may come in, and they come in for either a hygiene exam or they come in for an emergency. And what you're going to take is, of course, you're going to take x-rays, you're going to do some perio charting, and then you're going to break down what the patient's conditions into several different categories, like I have shown you here. So you're going to have patients who are healthy, and those are the patients who do not have bone loss. So that will be that stage. And these patients don't have bone loss. These patients are going to get a prophy, either adult prophy. This is the dental code for it in the U.S., and this is a child prophy. This is a dental code in the U.S. Those of you who are not in the U.S., these codes don't apply, but nevertheless, it will be the same process. Patients who are healthy, they don't have bone loss, they're going to get a prophy. And then they're going to get, prophies usually twice a year, every 6 months. Now, patients who have gingivitis, they have inflammation, so that's that category. They still don't have bone loss, but they have inflammation of the gums. They have deeper pockets, about 3 millimeters. So these patients are, they're still going to get prophies. But a lot of times, to reduce this inflammation, we may put them on more frequent prophies, so it could be like maybe 3 to 4 months. And the hope there will be to reduce the gingivitis, and then we still keep them on a prophy or cleaning schedule. Now, there will be some patients who don't have bone loss, but they have very heavy super or subgingival calculus. So that's calculus that's above or below the gum line, and those patients can be difficult to examine. It could be very difficult to probe as well. So those patients, you may decide to do what's called gross debridement. This is the code in the U.S. But the point of the debridement is that you can do a better exam and doing better perio charting, and then you're going to reevaluate the patient maybe like a month or 2 later, and you're going to take x-rays again to check for bone level. If these patients have bone loss, then of course we're going to get into the next category where you actually start seeing bone loss, which is going to be your early or mild periodontitis, or it could be, well, it could be early or mild, moderate, or severe. So you're going to get into this area where you have some bone loss. You're going to diagnose the patient. You're going to say either chronic or acute. Most of these are chronic because it has been going on. So the diagnosis is going to be chronic, generalized, or localized. So it could be just throughout the mouth, or it could be like certain spots. And then you're going to categorize it mild, moderate, or severe. And it's periodontitis. So you're going to say chronic, generalized, mild periodontitis. So that could be like one diagnosis. And now you have to also come up with a treatment plan for that patient. So what I usually like to do is break it down into severity of it, and that's going back to your chart. You're going to have mild, moderate, and severe cases. So if I see gum disease based on the x-ray and based on the level of bone loss that the patient has, and we're going to categorize it, remember, mild, moderate, or severe. So if the patient is has mild to moderate periodontal disease, then we're going to do root planing. And these are the dental codes for root planing. So it's going to be 1 to 3 teeth, or it's going to be more than 4 teeth. So that will be a quadrant. So if a patient has more like a localized gum disease, then it's going to be 1 to 3 teeth. If it has generalized, it's probably going to be a whole quadrant. So we're going to do scaling and root planing, and then once that's done, usually do it in 2 quadrants, like one side at a time. We're going to do maybe the left side and then the right side, and then we're going to bring the patient back in for post-initial periodontal evaluation or pipe, and that's just a reevaluation to see, if they have gotten better. We usually do that about 4 weeks later. And when you did the root planing here, you did full charting. The best time to do that is when the patient's numb, because otherwise they will be hurting. So you're going to do the post-initial eval. You're going to do full period charting about 4 to 6 weeks after you did the root planing. And then you're going to decide if a patient is okay. That means they don't have deep pockets, or the pockets are between 1 to 4 millimeters. Then you're going to put the patient on perio maintenance about every 3 to 4 months, and that's going to be for life. And this is the code for periodontal maintenance, and that's forever. If a patient is not okay, so that means they still have a lot of bleeding, they have deep pockets, then you're going to refer to the periodontist, who's going to treat that patient probably with surgery, and then they're going to make the patient perio maintenance and send them back to your practice. So that was the mild to moderate case. Now, if a patient has severe periodontal disease, you have 2 options. You can just either refer the patients for surgery to the periodontist, and they're going to do probably gum surgery, because these patients have 6, 7 plus millimeter pockets and bone loss. Sometimes they even have 8. So they're most likely going to need perio surgery by the specialist, who's going to treat that patient and then put them on perio maintenance and send them back to your practice. That's one option. The second option, if you don't think maybe the patient refuses to go to the gum specialist, that's what they need to do, but they're willing to do the treatment in your practice, that would tell them you're going to need surgery, but we're going to do the root planing in our practice. You can do the root planing in your practice if you wish to do that. You have 2 options. You could just tell them to go to the gum specialist and not offer any treatment for that patient, and that's it. That's really what they need. If if you think that the patient will do better if you do the root planing in your practice, you just have to tell them this is not going to probably reduce your pockets to a more acceptable range, but we can do it, but we're going to have to still refer you to a gum specialist most likely after we bring you back for evaluation. Now, so you're going to have a severe perio patient going to a periodontist, or you may do the root planing in your practice, and then you're going to reevaluate the patient in 4 weeks after you did the root planing for a severe perio patient. And what you're going to find is that the patient's pockets maybe went from 8 millimeters down to maybe a 5 or a 6, and they're still not okay, so they still have to go to the periodontist. But here you can make the patient perio maintenance, because they already had 4 quadrants of root planing, but they need to go to the specialist still, because they're going to need to have surgery to reduce those pockets to acceptable ranges and get a healthier gingiva. So hopefully this helps with the overall workflow of how to treat these patients with gum disease and how to get them back to a healthier range. Any questions or comments, just post it below this video. Have a good day. Bye.